Hey everyone and welcome. In this video we are going to look at a report that numerous hospitals sent elderly patients back home knowing they had the lurgy to care homes and did not inform the staff of the care home.
And I do believe that we have rotten politics, and I'm not using that as an exaggeration. Rotten politics in this country at the moment.
Now if this is true, it's another shame on our country. Bet you feel as sick as me over this. Because if the care homes didn't know, how could they protect the elderly? And the families themselves, etc. Who's clapping on Thursday now, eh? Are you? Let's read this disgrace, shall we? Deadly spread. Hospitals sent elderly patients back to care homes knowing they had the lurgy without telling staff. Yep, that's right. And this isn't just one hospital, but we'll read through the article and see you'll see what I mean. Hospitals reportedly sent elderly patients back to unwitting care homes despite knowing they had lurgy, triggering deadly outbreaks. The Care Quality Commission has received reports that several hospitals returned the infected patients to at-risk residential homes. These patients then triggered outbreaks that killed both elderly residents and staff who were unaware of the virus, and the staff's family, don't forget, who were unaware of the virus risk and wore inadequate PPE, the Daily Mail reports. The CQC is now investigating, with the hospitals potentially facing a prosecution if the claims turn out to be true. Potentially facing a prosecution if it turns out to be true. They should hunt down whoever made that decision and put them in jail forever, in my opinion. Now, I'm not too sure if you know, but a large proportion of the people that have become victims of the lurgy are from the residential care homes. I think we're up to nearly 7,000. Now, if this is true, how many of those 7,000 were because the NHS doctors and whoever it is that's made this decision sent ill people back to them? You've got to remember these care homes are in full lockdown, so none of the residents are allowed to leave or go anywhere other than in the building. You see why I'm so annoyed at this one, everyone? They are also probing whether care home residents have died from non-lurgy conditions due to a lack of visits from the GPs. Can I just ask why GPs are not actually visiting people anymore? Is that because GPs are now classed as more important than the people they're supposed to save? Isn't there something called a Hippocratic oath that they all have to adhere to in this country? Or is that just total bullshit now? And a GP is more important than everybody else now. What's the point in someone that's supposed to protect others if theirs is more important? Kate Taroney, the Watchdog's Chief Inspector of Adult Social Care, told the newspaper, "We have heard of a few incidents where this has happened and it has resulted in infections spread to other residents in the care home. In cases where it looks like the information wasn't disclosed by the hospital, we are looking at whether the hospital breached their regulations and whether we can take action." See, that in itself tells me that nothing's going to be done about this, doesn't it? Not only this, we've also got to deal with the fact that people that have cancer and heart problems weren't getting seen either. It's an issue we take really seriously, really seriously, but you might not be able to take any action. Behave yourselves. The names and locations of the hospitals have not been released, but last month whistleblowers in Manchester warned patients were being discharged with lurgy without doctors or nurses disclosing the information. This is absolutely disgusting, isn't it? It's the same old adage though, isn't it? The elites don't care about the old. Why don't they care about the old? Because the old don't pay taxes anymore and they only take out of the system with pensions. Absolutely disgraceful the way this country treats our old people sometimes. But let me know if you think the same. And the government came under fire last month when new guidelines stated negative tests for lurgy are not required prior to the admittance of a new patient. Care homes were also told they could take in people currently living in their own homes without any kind of testing for the deadly disease. I wish they'd stop calling it a disease. Point of interest, it isn't a disease, it's a virus. Totally different thing. The hospitals involved in the probe could be in breach of CQC's Regulation 9, which states patients must receive appropriate person-centred care and treatment that is based on an assessment of their needs and preferences. It is not a crime to not comply. It bloody well should be, but the watchdog can use civil powers to bring a prosecution or suspend or cancel their registration. Can I just say, if it's not a crime to not tell of a deadly virus, an institution that's got numerous at-risk people inside it that are not allowed to leave, it is a crime in my opinion. Any death that comes from that, the blood is on your hands. Am I wrong? Because it's starting to sound very, very dodgy. This isn't just, we're not allowed to tell them, is it? This is really, really malicious, is it not? This seems malicious. More than 6,000 people have died of lurgy in care homes across England and Wales. Shocking figures from the Office for National Statistics have revealed. And how many of those 6,000 were because the NHS had sent a sick person back there? Just a thought. Almost a third of all lurgy deaths were in care homes after the deadly bug hit some of the most vulnerable in our society. Yeah, and we effectively allowed doctors or the NHS or government to use our old people as lab rats. Now, I don't know if that is the case, but it is starting to look that way, isn't it? This needs to be investigated fully, in my opinion. We need to find out who did this, who gave the order for this, who actually did the information, who passed it on, who let them leave without it. We should hunt them all down and remove them out of the NHS, in my opinion, because they've automatically broke the Hippocratic Oath, haven't they? We must protect all people at all times, isn't it something along those lines, the Hippocratic Oath? The deaths of at least 6,686 care home residents in England and Wales between April the 10th and May the 1st involved lurgy. And how many of those couldn't see the family? They were alone when they passed. Alone. Whoever's done this needs to be found. And almost 4 times as many people are dying in care homes as usual at this time of year, showing how the disease has ripped through the homes in Britain. Lurgy is also present in around 13.5% of all care homes in the UK amid fears staff do not have the protection needed to tackle the killer bug. And what about the people in the place? You notice how no one's mentioning protection for the people in the place. It's just the staff that need PPE, not the other residents that are also at risk. Oh no, they don't need the PPE, it's the staff that need the PPE. And we're wondering why so many of the elderly are dying. It just sort of makes you wonder, doesn't it? The government is now including deaths outside of hospitals in their daily death toll, which currently stands at 31,000 in total. And I think that was a bad idea for one reason and one reason only. It makes us look bad to the rest of the world because nobody else is doing that, are they? Their numbers are all low because of it. You'll find out, give it a year after this is all blown over, and find out what the numbers are then, and I can guarantee you we will not be the worst, or anywhere near the worst in Europe. Around 200 frontline health workers have been killed by the disease, including care nurses. So not only did they send elderly back to risk the elderly, they also killed off staff as well. And you can guarantee most of those staff had a family. Most of the family now have it as well. How many of the families died as well? You see where I'm going with this one? This is not just, just send them back and let them go and pass in their own environment. No, because you're risking others. This is what they've been saying for so long, isn't it? Now, in regards to this, what are my feelings on it? Well, you know what my feelings are. I don't think the lockdown has done the people that are fit and healthy any favours whatsoever. But, in the same instance, think about this, the NHS are sending people ill back to places where our grands and our granddads and our old folk and our loved ones are being looked after. How is that looking after them? We need to make sure that this is not dropped in any way, shape or form, and we need to make sure that whoever was responsible for this are found and prosecuted to the fullest of the law, in my opinion. Well, let's have a quick read of some of the comments, shall we? Next Thursday, 8 PM. Yes, thanks for killing all our grannies and granddads, NHS. This is a disgrace. Whoever ordered this needs to be held accountable. I agree. Wondered how long it would be before the NHS got the blame for this. Well, who else are you supposed to blame? Who sent them back? Do you think Boris did it individually? Do you think he's gone into the hospitals and said, right, send all the oldies back? Maybe he did. But we won't know, will we, until we find out? There we go. I agree the hospital should advise if a patient has lurgy or not, but surely the residential homes need to also take some responsibility. Residential homes are not doctors. You do realise that nurses can't diagnose. It has to be a doctor. Some people are just idiots, aren't they? So you're saying that when the NHS says we are sending you a no-risk patient, the care home should double-check the truthness of that statement, demand all medical records, check them thoroughly in order to absolve themselves of any potential risk. Exactly. What an idiotic statement. Now, I'm absolutely disgusted with that because I have old loved ones in care home system and residential home systems, so I am terrified now that they're just going to send it. I mean, they're just going to send old people back. It means that no one's safe, not even in the care homes. But let me know what you think, everyone. I mean, do you think this will ever be investigated? Because I think whoever's done this needs to go on the gallows, to be honest. Slightly exaggerated for dramatic effect, obviously. But they definitely need to be prosecuted. But what say you? Let me know. If you're new to the channel, don't forget to hit the like, comment, subscribe, hit the bell icon. Stay safe. Don't go to hospitals. Looks like they're all trying to kill everyone. And I'll see you on the next one.